As we told you, schools, concerts, and businesses are just a few of the industries being affected by the recent coronavirus cases around the nation, including a presumptive positive case right here in San Diego County. Here to answer some of the questions regarding the virus is physician and CEO of the Kind Health Group, Dr. Georgine Nanos. Welcome.
Thank you, Ginger.
Really appreciate you coming in because I feel we need a medical perspective on this case that has really created hysteria.
Yes.
So let's start off with a basic. If somebody has these symptoms, which are mirrored to the regular flu, what should they do?
If you have mild symptoms, the important thing is to, and you're not at, in one of those high-risk categories we've been talking about, over 65, chronic health conditions like heart disease, lung disease, diabetes, or immunosuppressed in any way, then you need to stay home, isolate yourself, and make sure that you have enough supplies at home that you can take care of yourself, or have someone be able to take care of you and kind of be quarantined around you, so that you can recover at home and not infect other people. The big message here is that everyone really needs to remain calm. This is certainly different in what we're all experiencing. We're seeing these massive events being canceled, and I think that's adding to the hysteria. But we have to find a middle ground between total panic and being prepared and reasonable and thinking about this logically. We are going to all come out on the other side of this. Most of us will be fine, but it is going to be kind of weird for a little while.
Because it's realistic to say that a person not in that, concerned criteria, the over 65, the pre-existing conditions, chronic health problems, could have this and treat themselves at home without even knowing they have the coronavirus because it's so mirrored to the flu, treat themselves at home, recover, and then return to life as normal. Is that realistic?
That's the expectation. Yes, absolutely. That's what we're hoping for most of the population, especially those who are healthy.
All right, so let's talk about the testing kit. I understand it's a mouth or nasal swab.
That's correct.
But there's a big difference between the coronavirus testing kit and, let's say, just a regular flu test. Explain that.
Right, so the flu test that we have that's commercially available for most doctors' offices and ERs is a rapid test. This COVID, so to distinguish, there's a COVID-19 test, which is different. We have coronavirus tests that are already out there, but there's a new COVID-19 test that's just recently come out in the last day or so for more widespread use. And that is a PCR test, polymerase chain reaction. And so what that's looking at is the DNA of the virus, and it takes longer to process. And it's a 3 to 4 day turnaround. So we don't have a rapid test yet. I'm sure there's some in development, but right now we just don't. It's not available right now.
And that's one of the problems. But at all these ERs and hospitals, they don't have these unlimited COVID-19 tests just to test every single person that walk in.
No, not at all. So we have tests in our office that we're receiving today and tomorrow, but in really limited supply. They're just trying to work out the supply chain for all these tests to roll them out more widespread. And so eventually they will be more widely available. But right now, we really only want to test people who are at high risk and who have been potentially exposed. So the big differentiator for COVID-19 versus the flu is going to be people who've traveled to those 5 countries: Italy, Japan, South Korea, China, and
Iran. Sorry,
yeah,
there we go. Okay, so for the folks that are in that high-risk area, lots of folks have been saying, how are people dying from the coronavirus? And I keep hearing organ failure, but again, that's just along the lines of a flu-like virus, right?
Exactly. So it's whenever we get any kind of massive respiratory insult and your organs, particularly your lungs, are compromised in any way, it's going to be hard to recover from if you have pre-existing conditions that will make you prone to getting sicker. The thing we want to do is encourage people to continue to get their flu shots. We still have flu season going on all the way through May. Getting your flu shot will not only help you prevent flu, but if you are exposed to COVID-19, it'll help healthcare providers differentiate perhaps between that and the flu, so we have a better idea if you've already been immunized for the flu. And the other thing too is, if you have gotten the flu shot, then you're protected from the flu, you're less likely to contract the flu. And people who get the flu are more susceptible to getting secondary infections. So if your lungs have already been hit hard by the flu, they're more apt to get other viruses, including COVID-19. So you're really protecting yourself in several ways by getting a flu shot. They're still available. We still have them. Get them. And then the most important thing is focusing on our own stress management and keeping that under control.
You heard it from the expert. The doctor says, don't panic. We're going to come out on the other side. Leave the toilet paper alone, and you've got the tests available.
We do,
all right.
Yeah,
okay.
Supply. So.
Yeah, right. Excellent. Thank you so much for helping us out with some of this, because you're right, there's a lot of hysteria in it right now.
Yeah, and we're doing a lot of prevention efforts in our own office. We're doing telemedicine, and I'm hoping more primary care offices will move to that. So we're focusing on immune support for people and getting stress and crisis counseling available for people, because that is going to be something that's going to be coming up for a lot of individuals. It's going to increase anxiety as these weeks move on, and we want to be able to support our patients. So we're taking new patients, and we're doing telemedicine visits with the healthcare providers.
Okay, Dr. Nanos, thank you so much for coming in today.